Tell me about this branch. What exactly is medical genetics?
It looks at this DNA and tells us we'll have a higher risk of a specific disorder or not.
You're basically putting a lot of time on a single patient rather than actually putting on a volume.
So here we're really dealing with impacts on families rather than quantity.
This branch actually has a very, very low success rate.
This 1% would be 100% for that one child who has the disorder.
What are the mistakes students normally make while choosing a super specialty branch?
They go with the trend.
One medical myth you want to break.
That genetic disorders come with a stigma and that they are not treatable.
What do you think about this branch? Where will it be next 10 years?
We will understand genetic disorders better.
Immediately after doing DRNB, how much money can a doctor earn 10 years down the line and 20 years down the line? Hey guys, welcome to the Nachiket Bhatia Show. Today we have a very interesting guest, a field which normally people do not know about much. Our guest today is a medical genetist and a fetal medicine specialist, currently an associate consultant and assistant professor at Gangaram Hospital, New Delhi. With a strong academic journey spanning MBBS, MS, and DNB in Obs and Gynae, followed by DRNB in medical genetics, along with international certifications, she brings a unique blend of clinical medicine and genomics expertise. She has contributed extensively to research with numerous peer-reviewed publications, gene discovery work, international collaborations, active leadership roles in genetic society. Today, she joins us to talk about medical genetics as a career, financial stability in emerging specialties, the future of personalized medicine, and what young doctors should genuinely know about choosing this path. Let's put our hands together and let's welcome Dr. Veronica Arora. Welcome, Dr. Veronica, to the Nachiket Bhatia Show.
Thank you so much. It's a privilege to be here. I've been looking forward to this.
Ma'am, you have a very unique field, genetics. I think we have not done a podcast till now, and to be frank, there is not much information about this field. So you're the
Right.
perfect person to guide all the audience. क्या field है ये, क्या होता है? But before we get into that, I would like to know your journey. How did you get into the field of MBBS? Then the journey ahead.
Yeah, as cliche as it sounds, I have been wanting to become a doctor since I was a little girl with the doctor's set, etc. So lucky I was to get into MBBS, and from there I had a choice between medicine and gynae. And as fate would have it, I entered gynecology. I loved the field. I think obstetrics is powerful. You see life as at its best, at its most fragile as well. So I loved obstetrics. So I did not come to genetics because I did not like obstetrics. I came to genetics to find more answers which obstetrics really did not give me. So that's how the journey really shaped. I had a great time in college, and I think medicine overall is a good place to be.
Tell me about your days in Obs Gynae, your residency days.
So as we all know, obstetrics एक काफ़ी toxic branch हो सकती है जो थी. So I did it I passed from Calcutta National Medical College. It's a great college to get cutting in. बहुत cutting मिलता है. I did independent 200 sections and around 15 hysterectomies. And at that time, all the focus remained on cutting and surgeries. So when I came out, I did not have too much exposure to fetal medicine or genetics, but I always had in my mind that why are there some pregnancies which thrived well and some did not. So maybe from there I took on. Kolkata was a new place to be in, but still I made friends, learnt Bengali, and it was bhalo bhalo, all nice. Yeah.
You talked about toxicity.
Yeah.
What happened with you?
So, in the first few months, maybe toxic is too harsh a word, but was discriminated a little on the basis of origin from North India. Being a person from Delhi, they'd expect you to be more frivolous and, not, really merging into their culture. And initially, they also have and say things like, if we come to your city, you will not speak in Hindi. So the rounds were always in Bengali. But that was only like a stranger anxiety which children had. Once you become their friend, they are the best people. Bengalis are so loving. So initially it was tough. I struggled in my days to learn the subject, and on the rounds to keep my guards up that I will not be on the bad side of any of the seniors. But also I was lucky to find friends, and then things got better.
But the discrimination was there.
Mildly, initially, yes.
So
Yes.
they,
So similarly, there was slight discrimination in my MBBS days in Mangalore, South India versus North India divide. But I think that each child should go out of their comfort zone, out of their home to become stronger and more independent. The best days of my life were my MBBS days. So whatever discrimination is, but I think it shapes you for the good.
tell me about your residency, the first year of it. How was your typical day like?
So we woke up around 6:37, had to take rounds around 7:30 to 8:30. Then you have your seniors. You also present round to the second year, then to the third year, and then the consultant will come and take rounds. So over there in Bengal, we have RMOs, registered medical practitioners, instead of consultants. So they then take the rounds. So the worst were the days when you're post duty. You're so tired, and on each patient आपकी काफ़ी क्लास लगाई जाती है. So I think that could be definitely softer. There are practices like getting tea for your consultants when you're yourself not slept well and sleep deprived. So yes, those were the problems. Then we had a whole day of OPDs or OTs depending on the day, and then we went back, maybe had lunch, and came back again and took rounds again. So and then so the seniors didn't take round, so we did another bout of rounds with the second year and the third year. So that's how it worked. On the duty days, which we had thrice a week, you had a 24 plus, maybe 7 8, so around 32 hours of duty. But on those days you could not sit because it was that strenuous. But yeah, that's how it went.
32 hours of duty thrice a week.
Yeah.
It ain't easy, right?
It was tough, but I would say we learned a lot. We were so confident in procedures, in forceps delivery, inventors, that when I came back and did my senior residency in MAMC, I was better at it than most colleagues at that time. So I guess strenuous also equals more efficient later.
So do you believe that this kind of duty should be there?
Okay, see, so that I think is a very difficult question which Gen Zs would really hate me for. But I think the duties should be, they can be long, but there should be periods of rest in between. Residency is called residency because you're supposed to be residents of the hospital. So duties could be longer, but humans should be treated like humans and given adequate periods of rest and not become zombies. So that's what my take on this would be.
Most of the doctors are not good at planning. और उसी problem को solve करने के लिए I have created this planner. Plan your day, plan your goals and execute them on a daily basis. ये मत सोचो कि रैंक 1 आनी है. ये सोचो कि आज के दिन पे मुझे कितने टेस्ट देने हैं, मुझे कितने MCQ मार्क करने हैं और मुझे कितनी वीडियोस देखनी है. रैंक 1 तभी पॉसिबल है जब 365 दिन आप अपने गोल्स अचीव कर पाओ. इसको एक बार यूज करके देखो and give me your honest feedback. Is it really that helpful? Tell me about this branch in detail. Like,
Yeah.
what exactly is medical genetics?
So, medical genetics is a part of medicine that looks at the molecular code. We perform sequencing of DNA. We all have DNA, right? Each cell has a nucleus, each nucleus has a DNA. We all have that. So now this DNA has a role in health, it has a role in disease. Now, looking at medical genetics as a subject, it looks at this DNA and tells us whether a person who's carrying an abnormal DNA will be diseased, will be disrupted, will have a higher risk of a specific disorder or not. And this spans now across all medical specialities, ranging from obstetrics to oncology to neurology, etc.
If a student, if a postgraduate student wants to take up this field as their super specialty, what kind of personality should they have to best match with this branch?
So I think someone who likes to find out things, or who likes complexities, and who has a detective bent of mind that मुझे इसका आंसर ढूंढना है. People who like general medicine, who like to find diagnosis, maybe like a PUO, who no one really knows why that occurred. Maybe those sort of people. And people who are okay and tolerant of uncertainties. I say that because in genetics, a lot of times when our report comes, it says variant of uncertain significance. This variant is uncertain not because it is not disease causing, it is uncertain because at present we do not have enough information, Indian databases, in-house databases about that variant. So we have to really wait, we have to reanalyze the variant, we have to test different family members, and at the end we may not have the answer. So the person needs to be patient, tolerant, and have a, as I said, detective bent of mind. So really not good for people who want quick answers, and maybe a little diametrically opposite to people who want to do surgeries, that a patient will come to me and I will cure them that day. So yeah.
So actually, if I just try to understand this branch more, you are basically putting a lot of time on a single patient rather than actually putting on a volume.
Yes. So if I say in a day, we would be seeing around 8 to 20 patients. That's the range of patients we see, and it's definitely much lesser than what a colleague of mine who's in gastroenterology would be seeing, maybe 30 patients a day, and we may not even reach there. So here we are really dealing with quality. We are dealing with impacts on families rather than quantity. Yeah.
And do you think that this field can actually work only in the top tier institutes? I don't think so. In, let's suppose, a lower ranked institute, you will get so many patients, especially about medical genetics.
So I think we will get patients once we have built capacity, and once we have told the doctors which patients need a genetic referral. So even a couple who's married consanguineously, that is married within the family, they come to ask for understanding if their children will have a risk of genetic disorder. Common genetic disorders like thalassemia, SMA, people do not know about it. Once they know about it, once they know that their child can have a disorder which requires a lifetime of treatment, they will come forward and test it. So the key here is awareness. The key here is to make the physician as well as the common man aware of the potential, of the immense potential of genetics. The number of patients is not an issue. The issue is that people don't know who are the patients. So again, the choice comes that what we want from life, really.
So, person looking for money should not enter this branch.
Yes, I think so. It's an honest declaration. I don't think at present this branch is for money making if you're doing it ethically. Yeah.
So, let's talk about money then.
Yeah. Okay.
So, as per you, and this is a very important question for our
Yeah.
podcast.
Yeah.
Like, immediately after doing DRNB, how much money can a doctor earn 10 years down the line and 20 years down the line? Let's talk about the immediately first.
Okay, so immediately around 2 lakhs a month, and 10 years down the line, if you worked very hard, if you have done a lot of awareness programs, if you have everywhere in CMEs, etc., you've increased your patient base, you'd be able to earn somewhere around 7 to 8 lakhs, and I think that would not change that much in 20 years as well. I think the peak would be around 10 lakhs, because we earn from OPDs, and that earning always has a plateau. right? And there are not many procedures that can be done. There are some geneticists who also do amniocentesis and CVS, so the earning is quite good there. So my suggestion for obstetricians who want to come to this branch is also to learn amniocentesis and CVS, because then the earning becomes much higher than just doing OPD.
But it's also an investigation heavy branch. If you were the PM for a day, and I asked this to all my guests, if you were the PM for the day, what changes would you have made?
So, I am very interested in capacity building for genetic disorders. I think taking genetics to tier 2, tier 3 cities, conducting lectures, conducting CMEs for small group of doctors, because what I have noticed is that the same group of doctors come to all conferences and they discuss among themselves and go back home. Who is benefiting? No one knows. So we need to go to people's homes, to people's clinics, and tell them that you do this will require someone to really sacrifice their lifetime doing it, and I'm quite ready to do it. And the other thing, I think what the government can do is integrate genetics not as a small chapter, but like as a small subject into undergraduate education. I think once it's in the undergraduate level, everyone will know about it, and from there emerges all the doctors who have knowledge about dermatology, radiology. Why not genetics? Now that we know it is present everywhere, so why not MBBS? So those are my two ideas about the same.
I think Indian colleges are also not equipped to train about genomics or genetics. Hardly anyone talks about this field. So, thinking that a new MBBS student can learn about this field is a little bit being an overambitious person here.
See, I do not think so, because I feel that all we need is a lecturer who would go and take some lectures maybe every month. It could be, I don't think that we are seeing a lot of skin OPD in MBBS as well, or we are seeing biopsy of skin and diagnosing epidermolysis bullosa in MBBS. We just have an overview of dermatology. Similarly, we can have an overview of genetics. Maybe sometimes when they're sitting in their OPD, something would click, like I read about thalassemia, that is genetic. Maybe we should get the parents tested and prevent this family to suffer from that.
Tell me about what do you think about this branch? Where will it be next 10 years? I'm sure it must be an exciting time.
Absolutely. So I think in next 10 years, I would like to write advice gene therapy for this, and then a patient can go to the market, take that injection, put it, and be cured. So that is my hope for the future. But I think where do we be in next 10 years is we will understand genetic disorders better. At present, the biggest challenge for us remains that there are variants of uncertain significance due to lack of databases that we have. So we do not know that this variant is disease causing or not. In 10 years, we will understand diseases better, their origin better, their pathogenesis better. And in the meanwhile, we are already working on the treatments for the disease we've already understood. So the future looks bright.
Are there any subspecialties in this branch also?
Yes, so I think for students who want to take up this branch, important is to identify your niche. Like I am very interested in reproductive genetics. Also my OBG background has a lot to do with it. There is a subspecialty called oncogenetics. I think the major branch that is upcoming, because oncology is now majorly driven by genetics. The mutations that come on the cancer tissue tell you that which chemotherapy will it work or not, and can immunotherapy work in that cancer patient, completely avoiding chemotherapy. Then we also have specialty genetic branches like ophthal genetics or nephrogenetics. So a person can specialize in any one of them, but I think we are still not there that they will do only that, except maybe oncogenetics. People who will work in oncology and genetics, I think, will have enough patient and volume load to be working in a setup of oncology where they see patients in genetics. I already have geneticist friends who are doing so.
So, oncogenetics is the one with the best potential in the future.
I think so, yes.
And if you have to rate all other branches compared to oncogenetics,
So definitely reproductive genetics and then neurogenetics, and rest of the branches of genetics I think will be really integrated with their parent specialty. I think nephrologists are now learning genetics, but geneticists will not specialize as nephrogeneticists. So these are the main ones that we think of.
tell me about your. I mean, you are working as an AP in Gangaram, right?
Yeah.
So tell me, how's your day like there?
So we have a DNBSS course there. So we have a class every day where we teach students, and then we have 4 laboratories attached to us. We have a clinical genetics division, then we have a HLA genetics, biochemical genetics, cytogenetics, and molecular genetics. So 4 divisions, and I am in the clinical genetics division. So when we have classes, we have representations from labs, and then we have 2 students per year who are training to become geneticists, and then we have consultants who will all sit together and take a class. We have case discussions one day, journal clubs, seminars, interactions like that one day. So around 10:30, so 9 to 10:30 we will have an academic session, and after that we will have our OPD. We also perform something known as fetal autopsies, that is fetuses who are discontinued, who are abnormal or dysmorphic. We perform autopsies on those fetuses to understand better that what went wrong, and on those fetal sample we also perform genetic test to tell the family कि क्या प्रॉब्लम हुई, वो दोबारा तो नहीं होगी, और आप क्या कर सकते हो कि ये प्रॉब्लम दोबारा ना हो उसके लिए. सो वो fetal autopsy procedures के लिए टाइम होता है. So we do that. Then we have references from various specialities. From today I saw a patient with endometrial malignancy. It was an early onset, young onset malignancy. So we were called to discuss that if they need a genetic testing. For example, Lynch syndrome is quite common in a young onset endometrial cancer. So we will test for that. So we'd see references, then we have laboratory time, and we also do some NGS analysis. The gene sequencing needs to be analyzed. Once you have a sequence out of the computer, it is made up of millions of letters. What do we do with that letter? How do you make sense of it? So we do those analysis, and then again in the evening we have OPD. So that is how a day is like. It is quite busy and hands full, yeah.
After listening to you, I've understood this is of course a technology driven branch. It needs to have a lot of research on the back end, and of course a very great laboratory to work with. So do you think a geneticist, a medical genetic specialist, will have some kind of job opportunities in second and third tier cities, frankly, in today's scenario?
Yes, I think so. Because there are a lot of laboratories which will go and pick up samples. You do not need to have the laboratory right there. You see your patient, you advise the test, they can get the sample picked up from whichever city, and also the patient can go and give the sample. So the laboratory services do not need to be inside the clinic. All we need is a person trained in genetics. So there are a lot of opportunity in second and third tier cities. We have geneticists in smaller cities as well. It is not like only Delhi or Bombay has it. We have geneticists in Jaipur, we have geneticists in Kolhapur, so smaller cities as well.
I mean, even in Delhi, if you get an NIPT test done, the test goes to Bangalore to get it investigated.
We are now doing it in-house, but that is also recent. So see, there are a lot of companies. So your test was sent to Bangalore because your obstetrician may be associated with that lab, right? So there are a lot of mixes about the testing, but I definitely think that second tier and third tier cities are now equipped enough for at least picking up the genetic testing to be able to have a geneticist there.
Ma'am, what would be your advice to a new young medico joining this DM or DRNB? How should a young medical geneticist actually build a long-term stable career?
Right. So I think, okay, to start with myself, मुझे बहुत मज़ा आ रहा है. I would not do something else. मुझे यही करना है. I am involved in a lot of other things rather than just the hospital 9 to 5 or 9 to 7 job. There are a lot of awareness activities we do. So genetics is made up of clinical acumen, research acumen, and creation of awareness. So I go to so many conferences. I go to obstetrics conference, pediatrics conference, oncology, neurology. Everyone invites us to deliver lectures, to teach them. So in this branch you will command and get a lot of respect. You will get a lot of opportunities to travel, not just India but the world. I was also invited to Nepal for a talk, and Bangladesh and Dubai. So we will get all these opportunities. You will have a good time. So what I really suggest is that you decide that if you are interested in this branch, also the interest comes not just from I want to earn a certain amount of money. Though I said the amount of earning or finances may be limited, but there are many ways now in genetics that can help you to earn better as well. Getting associated with a laboratory and helping that laboratory with variant interpretation can help someone earn a lot more. I do not do it because I am quite satisfied with my hospital setup, and as I said, for me money is secondary, but that's completely personal. But if you want to earn money, there are different ways in genetics as well. You come here with a bent of mind that learning will be continuous, and that you have to identify which area I want to be part of and make a niche, build on it, teach on it, publish on it, and then I can assure you, you will have a brilliant career in medical genetics.
Ma'am, I love this fact that you're very passionate about this branch. All right, like moving from obs gynae to something new is, of course, was difficult. What do you think? And I've not seen, I've seen many students who, take, let's suppose, gastro for the name of it, for the money of it, but at the end, they are not happy. What do you think is normally, what are the mistakes students normally make while choosing a super specialty branch?
I think the most important mistake is that they go with the trend. Radiology and dermatology, top branches, but do you like to sit in front of a computer and have a good life, have a work life balance, or would you like to talk to a person, empathize, be happy, be grateful when the person comes and tell you आपकी treatment successful है, या आपने मुझे एक बच्चा दिया जो मैं नहीं हो पा रहा था. So I think what makes you satisfied, what makes you happy is something that you should first understand and not go by the branches that have been in fashion or being trendy, so as to call it. Then secondly, I think when these students, they go and pick up income over temperament. So there are branches like gastroenterology which are extremely paying off, but also those people who are earning that much are working from 9 a.m. to maybe 12 p.m. and they can work all day, I think 24 hours also, because gastroenterology, the number of patients would be so high. Sabko gas hai, sabko pet dard hai. So you have to understand that is earning equal to happiness for you? If it is, I think you have your answer. But to pick branches which will give you the satisfaction that you need as a doctor is extremely important, and to know that you are an individual and the society or the branches that are now being top are different than what you would want to.
Thank you so much, ma'am, for a very honest discussion. But we are not done yet. We still have some rapid fire questions for you.
Okay.
So, very simple two rules. You have to be super spontaneous and super truthful. So, are you ready?
Okay, yes.
One medical myth you want to break.
That genetic disorders come with a stigma and that they are not treatable.
A research area you are most excited about.
I think I've mentioned
Yeah.
it. Definitely recurrent pregnancy losses and help families have healthy children.
What's the one mistake or one step that you ever did back in your life which actually made you who you are today?
It's a tough one. So many mistakes I've made.
All right, a career decision.
So, I will not call it a mistake, but I wanted to do MD medicine. But during my preparation time, I was a little swayed by peers, etc., that maybe obstetrics is a branch which is, more in vogue at that time, and it is a forever branch. Maybe you do not have to do a super speciality as well. So I picked obstetrics, but my passion was in medicine. That's why I think I came back to a medical branch. So pick what you love.
So do you ever think that if you go back, you might choose MD medicine?
Yes, I could choose MD medicine because I really that time wanted to do medicine, but at present I am very happy with genetics because I am doing medicine in genetics. Genetics is a part of medicine, it is a medicine specialty too. So the universe will give you what you really love and want. So keep loving and wanting something so much, it will manifest for you.
One habit that keeps you most productive.
So I think I can multitask a lot. That also comes from being a woman, but yes, that is my USP.
One word that defines your career journey.
It would be relentless. I think what I'd like to maintain, and I have by God's grace, is that I will not say no to an opportunity. Even if that means that I have to work 5 times more or not be sleeping, not be eating, but I'd be saying yes, and I would try and give my 100% to it. So yes, relentless.
Thank you so much, ma'am. It was a great discussion and I loved every bit of it.
Thank you so much.
And thank you so much, everyone, for watching today's show. I believe a very unique branch, medical genetics. No exposure on internet, and everybody thinks क्या होता है इस branch के अंदर. And if you have watched today's show, I believe everything you need to know about this branch, ma'am has given us very honestly and very clearly. So pass this on to any friend of yours who wants to pursue this field and tell them it's a beautiful branch. Thank you so much, and as always, do not forget to like, share, and subscribe. Thank you, and God bless you.